We're going to go to James Carpretta. Excuse me, I said that wrong. James Carpretta.
Right.
So I said it right. Okay, I'm sorry. He's a senior fellow at the Ethics and Public Policy Center, and he joins us by phone. Jim, I apologize for mispronouncing the name. Thanks for being with us.
You're no problem at all. It's not an easy one, so I'm happy to be with you.
Jim, you saw the events unfold. Just before the holiday break, they're moving the employer mandate to 2015. Talk to me about the political ramifications. Why are they doing this?
Well, they're under tremendous pressure. I mean, the employer community was going to them, beating them up, saying, this thing is a disaster. You've set up a system that won't work. It's not going to be ready in time for us to file electronically the forms you're telling us we have to file. It's never going to work in time, and it's burdensome. We have to change all of our IT systems to do this. You're hurting employment, by the way, because the employer mandate is pushing all of these people into part-time jobs. It's trying to stifle small firms. If they go above 50, they're subject to the employer mandate. So a lot of firms are staying at 49. They're being known as the 49ers. So there's all kinds of bad incentive effects associated with the employer mandate, and employers were telling the administration about it, and they finally surrendered. This is a huge embarrassment for the White House. They're selling it as, oh, don't worry, it's just a one-year thing. Well, I mean, if it's such a bad idea to do this in 2014, why will it be a good idea in 2015? So I think they've really opened themselves up to a lot of problems.
It's funny that you mentioned that, earlier I played a clip of Nancy Pelosi equating Obamacare and to our founding fathers on Independence Day. And now I've got another news article out here, Nancy Pelosi welcoming the delay of Obamacare. It seems they don't have their act together. You mentioned this, that there are some economic ramifications here, and some of what you're actually saying is showing up in some of the employment numbers. I noticed that in today's employment report, part of the good numbers, we had 195,000 new jobs, and that was better than expected, but 75,000 of those jobs were in hospitality, and it was many who have just switched over, given up on finding work, and have become bartenders and waitresses. So it may be showing up already.
Yes, exactly. And they're all going to be working less than 30 hours a week, because the employer mandate says if someone works more than 30 hours a week, they're counted as a full-time worker, and the employer is then subject to the fines that the law would impose if they didn't get qualified health insurance. So employers all over the country in service industries and retail and restaurants and hotels are pushing people that are currently working at 35 hours a week down to under 30. So this is a big deal for a lot of employees, and it's one of the reasons why there's been political pressure back on the White House. I think at the end of the day, what's going on here is that the law is starting to unravel. If you can't do the employer mandate after 3.5 years of preparation, it really raises a lot of questions about whether you can do any of this.
Well, I know the business community. I know the business community has said that they're happy that this is, in fact, is being delayed, and some are even saying that this could actually mean that somehow the individual mandate could go. You wrote something in a recent piece, and I want to read this because I was very impressed with it, and I found it striking. That the delay, employers are under no obligation to offer insurance to workers. That's what's happening right now. But the IRS can still impose a tax on workers who don't have a qualified insurance plan by 2014. So it seems like they're doing everything to help business, but they're not helping the individual.
Yeah, I think this puts the Democrats in a terrible position politically. You're saying, well, employers don't have to fulfill this obligation because the reporting requirements were too complicated, but the workers who the employers are supposed to be offering to, they still have to have coverage whether or not their employer is offering it to them or not. So, they've now taken the hook, the financial hook off of the employers, but left it on the workers. I just find that an untenable position politically for the Democrats.
It was, of course, the Supreme Court that ruled this was all constitutional, and it all seemed to hinge around that word that I said earlier, the tax. That was the key word in the ruling, because if it had been a penalty, this might not have even be law today. It seems comical to me that you would call this penalty an actual tax. What are your thoughts?
Well, I mean, so for the individuals, I think it's quite clear that it was always written to be a penalty, and they just called it a tax just to allow it, as you said, to pass constitutional muster, which I don't think it did, but they said it did. So they bent over backwards to call it a tax just for that one purpose. But the reality is that individuals are on the hook to buy health insurance that must be approved by the government. There's no reporting requirement in place to figure out if their employer offered them a qualified plan, and yet workers are supposed to either sign up with an employer plan or go into the exchanges and pay very high premiums. They've taken out a very major element to make this system work and said it's not going to apply till 2015. They're going to be stuck with having to undo it for the individuals too. I'm quite certain of that.
Let's talk about the exchanges because that's a big part of course, of the Affordable Care Act, and from what I'm seeing, it doesn't look all that affordable. But it looks like quite a number of states have not done anything with regards to putting up an exchange, and they're leaving it to the federal government. We seem woefully behind. How far behind are we?
Well, there are news stories today even about a state where they're actively trying to do it, a state of Connecticut, in the state of Connecticut, where the person running the exchange really wants to get it up and running, is working hard with the administration, fully cooperative. And even he said, hey, I wish I had a whole more year to get this done because we're so far behind. I think that's an indication. They're behind in systems development. There's a thing called the Federal Data Hub, which all the exchanges are supposed to be able to access to find in real time income information on all the American workers. That has not been tested well enough. People don't think it's going to work very well when it's supposed to be up and running in October. Meanwhile, the consumer experience, that is, of going on the website to figure out which plans you have available to you. People are all over the country are saying it's not going to be a very good experience at all. It's going to be very truncated. The options will not be fully understood by the people trying to apply for the benefits. So the whole thing has a feel of a rushed, not very well thought out job. And, what are the implications of that politically? I'm not entirely sure, but I think it's going to be quite bumpy for the administration.
I think we're going to find out. It looks like it's going to be a long road here, and we'll see how this unfolds. Jim, thank you so much for being with us. We appreciate it. Thank you.